The CAR T cell products essentially is infused over 5-10 minutes. It's a bit of an anticlimax, but that's the time when we actually keep people in hospital, because one of the few things that we worry about with CAR T cells, if they're really active, is certain toxicities. The two big toxicities which have been noted with cellular therapy have been neurotoxicity and cytokine release syndrome. Now, what we found with our bb2121 experience was that the CRS signal was there in about 60% of patients, but the CRS signal was fairly low. It was grade 1 and grade 2, very manageable. There was a couple of people who had that grade 3 CRS, and not a lot of patients required the antidote to CRS, that being tocilizumab. So in general, we were very impressed by the safety signal of this. As far as neurotoxicity is concerned, we were actually pleasantly surprised by the signal, low signal of neurotoxicity. We did have one patient who had grade 4 neurotoxicity, and that patient I think we presented in great detail at last year's ASH. That patient, fortunately for us, has recovered completely. Going into this whole program, obviously our concern when we've taken such sick patients was, is such a strategy going to be tolerated by patients in their 50s, 60s and 70s in multiple myeloma, when this therapy was typically designed for acute leukemia in the good old days. And to our surprise, actually, it's been very well tolerated. We've had patients in their 70s on this treatment, and the neurotoxicity signal was less than 30%.